So you're welcome to SynLab's webinar on kidney disease. I will be introducing the speaker in a minute, but then I'd like us to have a brief on SynLab. Okay, so SynLab is a medical laboratory and diagnostics company. SynLab is headquartered in Germany. In Africa, we have two branches in the strict sense, one in Ghana and then the other in Nigeria. In Ghana, there are 14 branches currently. We have branches in Accra, Kumasi, Takoradi, Koforidua, Sunyani, Tema, Etibie, Goso, Bekwai, Techiman. We accept private health insurance. So, I mean, if you're in a corporate institution, you may want to check with us because definitely the private health insurance that you're using may be accepted here. We stand for accuracy, quality, and affordability. And then we have a home service, and we also have gift vouchers which you can get for your loved ones. Right. So our speaker for today is a very astute medical doctor. He's been a medical doctor for over a decade. Okay, he has a lot of experience. He's passionate about delivery of quality healthcare and educating the public on health-related issues, which is why he's our speaker for today. Okay, he's very interested in health coaching, particularly, and he really has a heart for empowering people to live healthy lifestyles as a way of preventing diseases. In his free time, he loves to listen to music and then also to play tennis. Okay. Now, I'd like you to know that this presentation will take between 30 and 45 minutes, after which we'll open the floor for questions. You may, as we go along, type your questions in the chat box, or you may raise your hand at the time when we're opening up for questions. If you put your questions in the chat box at the time when we were opening the floor for questions, we can then read them out so that doctor will respond. His name is Dr. Michael Kwaffo. He's an internal medicine specialist. At this point, ladies and gentlemen, I'd like to hand over to our speaker for today, Dr. Michael Kwaffo. You want to take it away?
All right. Thank you very much, Julius. Thank you for the very kind introduction. All right. Hello, everyone. Good afternoon to you all, and welcome to today's webinar. I'm excited to be here to share with you so that we discuss this very important topic. Everyone is concerned about kidney disease. I'm sure everyone knows somebody or has heard a story of somebody. Sometimes on social media, we are bombarded with the issues surrounding kidney disease and its treatment. So everyone is concerned. If you go to Kolebu and other teaching hospitals, the doctors there are very, very, very concerned because we are seeing a very worrying trend, which we all have to do our best to nip in the bud. So welcome everyone, and let's get started. So as Julius mentioned, I will make sure to allocate some time for Q&A so that we can have a very interactive session. So by way of introducing today's discussion, I'll talk a bit about the kidney, what it does. The aim of this all is to empower people. Everyone should be empowered to make quality health decisions. Don't leave your healthcare to chance. Don't leave your healthcare for somebody else to mess it around. You have to be able to take charge and be in charge of your health. So we'll talk about how to assess your risk for kidney disease, the causes of kidney disease, and really how to keep your kidneys healthy. All right, so to start from the very, very basics, let's move on, please. All right, So I use this to, I mean, illustrate this how the kidneys are. Some people do not know that you have two kidneys. Everybody has two kidneys. There's one on the left, there's one on the right. Now, in this picture, I'm showing the stomach, the intestines, the liver, all the abdominal organs have been removed. So in truth, the kidneys are relegated to the back, you know, the back sides of the abdomen. So when you touch your belly, the kidneys are nowhere near there. That place is full of intestines and other organs, but the kidneys lie more to the back and to the side. So the kidneys are on the flanks, on the sides, not, you know, not at the front. Now, as you can see, the kidney has a blood supply. There's this red tube, blue tube that sends blood to the kidneys. There are some tubes that come out of the kidneys we call the ureters. That's where the kidneys make urine and then pump urine out through the ureter. So the kidneys make urine. Blood goes to the kidneys work the magic and removes waste and puts it into urine. So kidneys make urine. The urine will travel through the ureters and into a chamber we call the bladder for storage. Now, after a while, your bladder gets full. You have a sensation to empty your bladder. The reason I'm showing this is because all of these aspects, all of these tubes and channels that are connected to the kidney could be sources of, problems for the kidney. So if you have a problem with your ureter, if you have a problem with your bladder, for the female side of things, even cervical problems with your uterus, for males, problems with your prostate, all of these things can go and cause problems for the kidneys. So we'll talk much more about these later. All right. So the next slide, there's a bit of a delay. Good. So what do the kidneys do? What do the kidneys do? As you can see from this cartoon, the kidneys, the very basic role of a kidney is to filter the blood. So the kidneys serve as a filter. So this is Mr. Kidney holding a sieve and it's filtering some waste products and dumping them into this bin. So imagine the bin is the ureters, urine flowing out. The kidneys collect these waste particles from your blood and then dump them through the urine. So the kidneys play a very, very, very important role. Now, where does these waste products come from? They come from, your metabolism. As you are going up and down, eating, drinking, all kinds of things. I mean, just being alive, your body is working. And once your body is working, the waste products will be produced that would have to be flushed out from the system. And the kidneys are meant for just that. Now, the kidneys also maintain balance of water, balance of acids, balance of salts. There are so many things that kidneys are doing to make sure that everything is regulated tightly. The kidneys are very, very important. These are very important functions that the kidneys perform in the human body. Without the kidneys, everything is going to be out of balance. So the kidneys are very important. Finally, the kidneys also help to maintain your blood levels. In addition to doing the filtering and balancing, the kidneys also produce some chemicals, that are very useful to help your blood levels stay up. Without the kidneys, you'd have anemia. Anemia simply means that your blood levels become low and lower and lower. All right, so let's move on to the next slide. Right. So there's a growing trend. We as doctors are seeing a very worrying trend, not just in Ghana, globally. Kidney disease is on the ascendancy. One fact about the kidney is that the kidney is a very resilient organ. It is able to take a lot of insults. If you slap the kidney will turn the other cheek. You punch it, it will turn the other side. The kidney is a very resilient organ. It will take and manage problems, insults without complaining. And then years and years and years later, when it has reached its limit, it begins to fail. So kidneys are very resilient. Now, this fact I have just said is the reason why kidney disease can be a very, very silent killer, because there is a problem, yet you are unaware of it. There's a problem, there's something you are not doing right, there's something you are doing to your body, sometimes unknowingly, which you are dealing with, you are managing, the kidneys are also managing without complaining. Now you can go on for 5 years, 10 years, sometimes even 15 to 20 years. And then later, after a while, from nowhere, surprise, surprise, you realize that your kidneys are failing. It's estimated that over 850 million people worldwide suffer from chronic kidney disease. In Ghana, a recent research done by Dr. Elliot Tanner, who is in Kwaffo, a good friend of mine, he estimated kidney disease to be about 13.3%. That means that if you take 100 people, roughly about 13 of them would have some form of kidney disease. This is indeed a worrying trend. Now, on the ground, doctors on the ground, day in, day out, as we work, we are seeing, things that 10 years ago we were not seeing, 15 years ago, young people who do not have the traditional risk factors, they are all coming down with kidney disease. And this is very, very alarming. This is very, very worrying. Now, we have seen some trends, and we've been able to have some explanations to some of these things, the reasons for the growing trend of kidney disease. Next slide, please. Right. So in Ghana, the most common causes of kidney disease, number one and number two, hypertension, diabetes. They are the most common causes of kidney disease, kidney failure. If you take a census of people who are on dialysis, over 75% of them have had hypertension and diabetes. Now, this is very, very, very worrying, because yes, there is a rise in hypertension and diabetes over the world, and also in Ghana. People are developing hypertension much earlier. It used to be a disease for, people growing older, but now people in their 30s, in their 40s are developing hypertension and also diabetes. This has come about for different reasons. Mainly is our lifestyle. More and more, we are eating all kinds of things, adopting Western diets, high sugar, calorie diet, and we are exercising less and less. We are in our air-conditioned cars, taking life cool, and we are not exercising. We're not as active as we used to be several years ago, decades ago. By that I mean our grandparents were going to the farm. They were very active, eating things with very, very minimal chemicals. Now here we are, life has changed. So with the rise of urbanization and development, lifestyles are changing. That has brought about a rise in hypertension and diabetes. But the thing here is that whether it is controlled, uncontrolled hypertension, uncontrolled diabetes is a problem. If you've not been able to prevent hypertension, which I'll talk about later, yes, there's a rule for preventing hypertension. There's a rule for preventing diabetes in the first place. But if you do have it, you have to make sure that your figures are controlled. And in doing that, you are reducing your risk for kidney disease. Several people have had hypertension for decades, 30, 40 years, 50 years, and it has not affected their kidneys because some of these people have been very serious about, maintaining their health. They've done things right. They've stayed up to date. They've stayed, informed. They've worked with their doctors, and things are okay for them. All right. Now, another reason we are seeing is that there's a lot of health misinformation. That's what I call it, health misinformation. Everyone, because of social media, everyone wants to put out health information out there. Some are true, some are half true, some are just 25% true, and some are blatantly untrue. And unfortunately, because of social media, some of the very false, untrue things get a lot of traction, and people take these things up, and it creates problems. Okay, they adopt very harmful lifestyles because they found some of these things on social media. In Ghana, particularly, I'm also very, very concerned about what we hear on radio. Sometimes we invite radio stations invite people, and as a doctor, I sit behind and I throw my hands up in the air. I'm like, what on earth is this person talking about? All right. There is a very serious problem we have, unfortunately, in Ghana, in that um, people, because of economic reasons, I mean, capitalism, people have to sell their products, people have to sell, something. Some of the pharmaceuticals, some of the medicines, the herbal products, the concoctions that are being sold are blatantly harmful. We see some patients who come in, very young person, 35 years, and his kidneys are declining. You question, you take a detailed history, and you find that he's been drinking so and so for performance here, performance there, for enhancement of this, enhancement of that. And it is shocking. Without any question, without questioning the product, without looking, seeking advice, second opinion, people are taking all kinds of things because of health misinformation. All right. There's also an absence of the culture of, health checks. At least yearly, every year, once in a year, you should have an appointment with your doctor just for the purpose of doing a thorough medical check of your body. How are things working? Even if you can't do a full bouquet, you can just pick a segment of it for this year. Following year, you can do some aspects of it. People have gone years without knowing how their bodies are working, just going up, down, wake up, and then you move, eat this, eat that, and then they're just moving. All right. So that is also a problem because there is a window of opportunity. If someone develops kidney disease, there's a window of opportunity that doctors can use to be able to either reverse completely, we can either arrest the problem and prevent further decline. So when you're able to pick these things up early on, you are able to do a lot about it. Now, there's also a rise in the consumption of untested, unapproved medicinal products. Like I mentioned earlier, the industry, the healthcare industry, the pharmaceutical industry, it's a business. Really, it is a business. People are making, they are selling something to you. And sometimes, unfortunately, elsewhere you have a very strict, a very tightly regulated environment whereby everything on the shelf is being tracked and monitored. Every single product has a batch number, everything. So as soon as a problem develops or is detected, they're able to trace back and then, But unfortunately, we have a gap in our system. People, I mean, I saw a video on social media where somebody just mixed up some malt with a little wine in there to introduce some bitterness, and then just mix things up and then just jumped on a bus and he sold a few bottles. I mean, he was just using that as an experiment. He sold a few bottles with some charisma, and he was okay. He had a few Ghana cedis in his pocket. So there is a rise of consumption of, you just don't know where the product is coming from. Somebody is marketing it, and that is enough for you to buy it. We can do better. So there is a serious rise in this phenomenon, and that is a problem that is contributing to the rise in kidney diseases. Now, lack of knowledge and failure to verify health information. Um, you need to be a little cynical these days. When you hear something, you need to verify. Check and check again. Be very sure, is this source trusted? Talk to your doctor about it. Okay. I would also admit that there's a poor primary healthcare system in Ghana. It's still not developed as it should be. Elsewhere, everyone has a particular doctor that follows you up for a very long time. So the doctor knows your history, knows everything about you, knows a lot about your health, your risks. But unfortunately, people go to hospital A, clinic B, health center C, and your health information is scattered all over. So we are not working together for patients. So the health system also has a problem. And all of this is contributing to kidney disease in the country. All right. Now, when it comes to kidney disease, there are two types. Okay. There is an acute kidney disease. Acute just means that it's just recent. Something has sufficiently worried the kidneys within the past, 3 months or so. You were fine. When we trace back, you were perfectly okay. Everything was great. And then all of a sudden, your kidneys have just begun to decline. Okay, so that's called acute kidney disease. On the flip side, there's chronic kidney disease. Chronic means that this is long term. It's been going on for more than 3 months. It's been going on insidiously, gradually, gradually, gradually. If you ask me, the acute is somehow better. Well, acute is dangerous. It can knock you off, but if you're able to pick it up early enough, it is very easy to reverse. I think I'll change my mind. Maybe chronic is chronic kidney disease gives you a window of opportunity. Okay, for which if we pick up early, we can reverse. Okay, but acute, things like toxins. If you come into contact with a chemical, including drugs, including herbs, including some products, toxins that you put into your body, if something is not right for you, the kidney, because the kidneys do the filtering, they are usually at the first to get disturbed by that, and that can cause an acute problem. Now, some infections, if you have a very, very bad infection, UTI, urinary tract infection, pneumonia, even malaria, a very bad case of malaria, you could develop an acute kidney problem. But usually, once you solve the underlying problem, the kidneys are very, they're very resilient and they bounce back. Accidents, trauma, surgery, and then sometimes pregnancy complications. All of these, there are several others, but all of these can cause an acute kidney problem. Now, when it comes to the chronic kidney disease, the chronic kidney disease have been going on gradually, insidiously for a very, very long time. And typically, I mean, this would be over 5 years, over 10 years. Small degrees of injury to the kidney over a very long period can do that. Commonly, hypertension, diabetes, prostate disease, cancer, sometimes autoimmune disease, all of these can cause chronic kidney disease. So what are the common causes? What are the risk factors? Now, if you have uncontrolled hypertension, if you have hypertension, you're at risk. But the risk is higher if your BP is not controlled. All right. Now, listen to this. Some people get diagnosed with hypertension. Mind you, the time you got hypertension is not the same. The time you got diagnosed with high blood pressure is not the same as the time you actually developed it, because sometimes the point you developed it cannot be really known because you have not been checking. And it could be that you've been hypertensive for probably about 3 4 years, and then on one time you went to check your blood pressure and you realized it was high. So that 3 4 years for which it was undetected, you were at risk. Your kidneys were having a hard time trying to cope with high blood pressure. Now, if you get diagnosed and you are not, some people are not sure, they argue about it. They say, no, I'm not too sure. Let me observe it some more. Let me not take this medication. I think this medication is not good for me. Someone's on radio, they say I shouldn't take my blood pressure medication because it's going to do this, damage my kidney, is going to damage this, damage that. All that time you are, marking time, you are not on treatment, your kidneys are in trouble. Okay, so uncontrolled high blood pressure is a problem. Like I mentioned, number one and number two, high blood pressure. The second is uncontrolled diabetes. It's not a problem to be diabetic. Okay, being a diabetic puts you at risk, but the problem comes when your diabetes is uncontrolled. So if your blood pressure is greater than 140/90, please see a doctor and let's start talking. Okay. If your blood sugar levels when you haven't eaten anything is more than 6, I mean, you should see a doctor. Okay. 7 is when we get the diagnosis, but when you are more than 6, it means that there's a problem. You are pre-diabetic. We need to start talking about that. Okay. Now, taking harmful substances, herbs, medicines, okay, these are also common causes of kidney disease. If you have a family history, if somebody in your family has ever developed kidney disease, you should talk to your doctor about it. Okay, there could be some problems, genetic problems that may predispose you to kidney disease. All right, infections, hepatitis B, hepatitis C, HIV. These are all things that can cause kidney disease or increase your risk for kidney disease. Some cancers do that, autoimmune disease do that. When your prostate, you have prostate enlargement and is unchecked, it can cause kidney disease. And sometimes some people have, from birth, some defects that were not detected early enough, and sometimes may lead to kidney disease later in life. So these are the common causes or risk factors for kidney disease. So what happens when the kidneys fail? I mentioned earlier that the kidneys make urine. The kidneys make urine, and each time you're passing urine, you are actually flushing bad stuff out of your body. So when you are seeing urine, clear, nice urine, you should be excited, because when somebody has chronic kidney disease, the kidneys are, one of the first things they notice is that urine, flow is very scanty. You can drink 2 liters of water the whole day, and just about 500 mils come out. That is worrying. Okay, so what happens when the kidneys fail? You have reduced urine quantity, you retain a lot of water, so they begin to swell up. Most people will develop anemia, low blood levels. You feel terrible because of poisoning of the blood by some of these waste products. You have increased medicine side effects because your kidneys are doing a lot of work they also help to break down medicines. When you take drugs, the kidneys help to flush them out. So you tend to have increased medicine side effects when you have kidney problems. You can develop bone disease. Yes, the kidneys help with bone strength. So when your kidneys fail, you develop bone disease, you develop heart disease, and your risk for stroke also goes through the roof. So these are some of the consequences of kidney disease. Now let's talk about signs and symptoms. How can you tell by way of signs and symptoms that you may have kidney disease? Next slide, please. All right. So it's not absolute. I don't want you to freak out and then start saying that, oh dear, I have kidney disease. You may not have kidney disease, but these are the common signs and symptoms that should make you probably talk to your doctor about. So signs and symptoms: reduce urine quantity. I mentioned that. Now, if your feet are getting swollen, okay, this can happen normal people when you sit for hours on a flight, on a long bus ride. But if you are having swelling feet, swelling around your eyes, especially when you wake up in the mornings, this should probably trigger a discussion or a visit to the doctor. Okay, if you are getting tired easily, especially because of low blood levels, okay, several other things could cause this, but it's something to report to your doctor. If your urine is excessively foamy, now anytime I say this, I mean, I get calls and calls and calls, a few days later, because everyone is worried that my urine foams a bit. Of course, when you urinate in, the water closet, just because of the urine just falling in the water, you would have some bubbles. But when I talk about foamy urine, the urine foams up almost like soap ladder. Okay, so when you see that, that is not a good sign. When you see blood in your urine, that is not something to play with. You talk to your doctor immediately. When you have pain when you urinate, when you have difficulty urinating, that's also something to talk to your doctor about. Okay. Now, I mentioned that the kidneys are usually at the back on the flanks. Okay. When you have pain in that area, it's also a cause for concern. Now, abnormal urine test. Some people do not have any symptoms whatsoever. They are well, they're going up and down, no problem. They take a urine test for some other reason, and then there are some abnormalities in there. Whenever you have an abnormal urine test, we need to check your kidneys and make sure that there isn't any problem. Okay. When there's protein in your urine, it's a cause for concern. When there's blood in your urine, it's a cause for concern. So these are the signs and symptoms of kidney disease. Now, I'm sure you are asking yourself, am I at risk? Is there anything that I may be doing that could predispose me to kidney disease? Am I at risk? Now, how can I be sure that everything is okay? How can I be sure, all right, that my kidneys are functioning well? All you need to do is just book a consultation with your doctor. We have to develop that culture, okay? At least once a year, visit your doctor, spend some small money and talk to your doctor. This is what I have. This is my medical baseline medical problems. I take so and so medications. Are they okay? My family history is so and so. Your baseline, and then your doctor will assess your risk. Okay. Now, when you want to know whether your kidneys are functioning well, you can do a kidney function test. Okay, a kidney function test. We sometimes will add a urine test. Most of the time, we add a urine test, kidney function test, a urine test. We also do an ultrasound just to scan the kidneys to make sure that they are also looking well. Okay, and then we also check for protein in the urine. So these are the basic things we do. If you want to know your risk for kidney disease, please book a consultation with your doctor. Let him assess you, ask very important questions, and then run some lab tests to know where your levels are. It will help you because there is a window of opportunity whenever you have chronic kidney disease or even acute kidney disease. There's a window of opportunity where your doctor can do a whole lot about. But if you delay and it progresses. I mentioned that the kidneys are very resilient. They will not alarm you. They will just try and cope. And then it may be too late when we detect it, when you start developing signs and symptoms. All right. So this segment, I'm going to talk about 6 things you can do to promote healthy kidneys. Just 6. 6 things you can do to promote healthy kidneys. Number 1, to start things off, you have to know your baseline. You have to know where you are starting from. What is the state of affairs of my body? How is my body faring? So I've mentioned this already. Talk to your doctor. Let's talk about risk factors. Now, risk factors are very important. Hypertension, diabetes, the commonest. other baseline medical problems, autoimmune diseases, if you have prostate problems. Let's talk about the risks, because there's a lot that can be done in that stage. If you're hypertensive, we need to talk to your doctor, get very, very personal with your doctor. Let's talk. Some people have a lot of questions, a lot of mistrust, actually, when it comes to healthcare, because of the health misinformation that I mentioned. There's a lot of misinformation. Now, some people say that, oh, BP medication, when you take medications for your blood pressure, it destroys your kidneys in the end. That cannot be further away from the truth. Now, I'm going to use very real life example. I mean, I've experienced this firsthand. It's so common. Now, Mr. AB is, 50 years. He's been hypertensive for over 20 years. He comes in to a hospital. His blood pressure is not controlled. He said, "Oh, doc, we are trying. I'm taking some, what dawa dawa. I'm taking this. I'm taking that. As for the BP drugs, the orthodox medicine is not the best. Though I hear it will spoil my kidney." Now he goes in and out. He does this back and forth, not taking his medications. Intermittently, he will take his pills for a while and then he will stop. He will take his pills for a while and then he'll stop. Now, when he's 55, he develops kidney disease and turns around and says that, it is the medication that I was taking intermittently that has destroyed my kidneys. Now, another person is also hypertensive. Mr. DA is hypertensive, and he has been hypertensive for more than 40 years, being very disciplined, has controlled his medication, his blood pressure, always very, very beautiful figures. And up to now, the medications have not spoiled his kidneys. I mean, people are they're not verifying facts. You need to verify facts. If you have a problem, you don't trust your doctor, find a doctor that you trust. Please, you need to talk to your doctor. Like I mentioned, there's health misinformation. People are selling all kinds of things. They want to make some money, and you can't give and trust your whole life, your two precious kidneys, to somebody who is bent on making, money by all means necessary. So first point, know your baseline, talk to your doctor, let him get you checked out. Number two, good. Number two is that please, this is becoming too common. People are popping pills, medications, herbal this, herbal that. Oh, you see, a typhoid, then they take bionic tonic, then they take this. Recently, this is fresh, just about a month ago. I met a young person, he's less than 40 years, and he goes to a place and they say, oh, this is a kidney cleansing tea. Kidney cleansing. You have normal kidney, your kidneys are working well. What cleansing again are you doing? The kidney is the cleanser. You want to go and cleanse the cleanser. Please leave those kidneys alone. We don't ask questions. We just want to take something because, yes, everyone is worried. But please, if you have any concern, talk to your doctor first. Okay? I mean, you have to shine your eye because people, the marketplace out there is, and people are selling stuff. They are just selling stuff. Please be careful. Okay, so painkillers, some prescription drugs, I mean, the drugs are good in themselves, but the dose, the duration is what turns them toxic. Diclofenac is fantastic. When you have pain in your muscle, pain in your bones, diclofenac is great. Ibuprofen is great for fever. FPAC is good. Rapinol and co, they are fine. But some people are taking it daily for over a year for other reasons. Oh, whenever I come from work and I'm tired, I need to take some FPAC just to, make me feel, good. How? How can you be doing this? Okay, if you are taking diclofenac for more than a week, I mean, you should be concerned. Okay, ibuprofen, these are called NSAIDs. Paracetamol is relatively safer if you need to take medications for pain medication for long term. It's got to be paracetamol, or you need to talk to your doctor for your doctor to, show you what is best to take. All right. Um, Untested herbal medications not approved by FDA. I already mentioned this. We have a problem when our system is not able to tightly regulate things. Somebody can mix. I can actually decide right after this webinar to mix malt with red wine, with white wine, with some dawa dawa leaves, precase, and I just jump onto a bus. I bet you I'll make some 100 Ghana right now, quick, no questions asked. Nobody's going to make it. I mean, easy money. All right, people will buy. Okay, I just need some charisma. That is all I need, and I'm good. All right. So, some people are taking your doctor is prescribing something for you, and you can have a very honest conversation with your doctor. Doctor, what are the possible side effects? Your doctor should be able to tell you something that, okay, this, if you're concerned about your kidneys, doctor, could this affect my kidneys? Ask questions, please ask questions. Number three, so aim to drink at least 2 liters of water every day. This is at least. When the weather is hotter, you are sweating, you are going to the gym, you are, exercising, you need to drink more. When you are ill, you have a fever and other things, you need to drink more. So minimum is 2 liters. You have to make that a habit, okay? So, these days people are carrying bottles around. I have my water here. Let me just drink some for a toast to kidney disease. Okay, we need to stay hydrated. Just keep drinking. Stay hydrated. It's very, very important. The kidneys are not asking for any cleansing. They are not asking for any tonics. They just need water. When you give the kidneys water, they just do they are at their best. They just help, they clean the blood better, they filter better. Okay, so don't be unnecessarily dehydrated. Let me teach you a trick. Now, if you go to the washroom and your urine is concentrated, okay, clear, like it's not clear, it's not even light yellow, it's almost deep yellow, you can actually see the yellow, it means that there's not enough water in the system. The kidneys are trying, they are struggling to, help you out. So once you're going to the washroom and you're seeing that, it's a sign that you have to increase. When you're seeing clear urine, you should be very happy. That is a good thing. All right. So please stay hydrated always. Number 4, I've said this already, periodic health checks with a trusted doctor. The trusted doctor is what I want to talk about here. I mean, I've said this again, over and over again. The market is, people are doing all kinds of stuff. People are cutting corners. There are problems with regulation. Don't go and sacrifice yourself. Now, imagine you have a problem with your car. Then you're not going to look for, somebody who just started off maybe 3 months ago, mechanic. You are looking for somebody who knows what they are doing. If you have a plumbing problem, you want to the best of the best, because you can't mess up your car. You can't mess up your brand new car by just walking to some place, some shop somewhere. No, these days there's information you can verify. You can seek second opinion. If somebody wants to give you so and so, you're not sure about it, because of your health, you've got to seek second opinion. Ask questions. Stay informed. Stay sharp. Okay. So, my father-in-law would always send me all kinds of recordings. Someone has sent him this on WhatsApp, and they're saying that if you have this, you have to walk barefooted. Diabetes, you have to walk barefooted so that it will help with flow. That is completely ridiculous. Because if you're diabetic and you get a cut, already some people are diabetic and they have problems with sensation in their foot. You get a cut, that could lead to something terrible. And already this thing is spreading like wildfire. People are walking by the roadside barefooted. They say, yes, I'm helping circulation. You're not. Okay, so you've got to ask questions. People are sending WhatsApp, they are asking questions. What should I do about this? I've been given so and so. Is it okay? Should I take this? Someone is selling, this tonic here, cleansing here. You have to ask questions, stay informed. It is very, very important. If you don't trust your healthcare, provider, find another you can trust. And when you find someone that you trust, stick with your doctor. People have gone to medical school, have studied for years, 7 years, 8 years, 10 years. I mean, they are people who know what they are doing. You should find a doctor who knows what they're doing. Okay, it is super, super important. All right, good. I've seen there are some doctors on. They are giving me thumbs up because I mean we are very, very worried. This is super, super worrying. Okay, so next on number 6, control risk factors. Yeah, let's go back to number 5. That's number 5. Risk factors, risk factors, risk factors, risk factors. Now, it's not wrong to have hypertension. Now, listen to me clearly. Okay, number 6, we'll talk about prevention. Hypertension is best dealt with by preventing it. If you are less than 30 years, you have to start thinking about preventing hypertension, preventing diabetes in the first place. I've already said that number 1, number 2 position for kidney disease, 75% of all kidney disease, hypertension, diabetes. So you are better off preventing it. How do you prevent hypertension? How do you prevent diabetes from even happening in the first place? It is done with lifestyle. Okay, our lifestyles are changing. We are not eating the right stuff. We are not even exercising in our cars, going back and forth. We're not moving at all. All right, so it's best prevented with lifestyle. You have to be exercising minimum 3 times a week, and that exercise should be about 30 minutes long. Now, if you are 30 years, you have no business walking for exercise. I get them all the time. Oh, I go for walks. Walking is not for a 30-year-old. When you are 70, you can go for walks as exercise. But when you're a 30-year-old person, boy, you have to be sweating. Your heart should be pumping in your throat. You should be just doing, serious exercise. Okay. When you do that, your body learns to use calories. Your body learns you get your metabolism right. It sets a very good tone for you for when you are 40, 50, 60. So it is hypertension, diabetes. You best manage them by preventing them in the first place. Diet, excess calories. We have to prevent them. Okay. Then number 6, that's it. So lifestyle, you just prevent the risk factors. Low salt diet, control portions, high spikes of glucose, eating burger here, burger there. I mean, it's good, it's nice, but you know that you have to balance it. When you eat small, then you go and exercise 2 portions of double portion of exercise. So yes, next slide. Frequently asked questions that we get. I've mentioned a lot of them. What tests can I do to check my kidneys? I've mentioned them. Kidney function tests, kidney ultrasound, and then urine analysis. Those are the very basic ones you can do. How often should I check my kidneys? It depends. If you are hypertensive, you are diabetic, probably a lot more frequent, maybe every 6 months. If it's under control, maybe yearly. If it's not controlled and you've had some problems or concerns with kidney issues, you should be checking it frequently. But if you don't have any problem, low risk factors, maybe yearly is okay. That's good. Now, another question I get is I have high blood pressure. How true is it that my medications will cause kidney disease? That's super, super, super common. And I've said that, yes, we are aware, doctors are aware, some of the medications, if you do have some already existing kidney, problems, it may lower your kidney function a bit. But usually when we do it, we monitor and then but majority of blood pressure medications are perfectly safe for your kidney. All the diabetes medicines are safe for your kidney. Okay. Now it is the uncontrolled hypertension, it's the uncontrolled diabetes that is the problem. Okay, if you are taking your medications infrequently, every now and then your sugar is, problem here, problems there. Some people are admitted 4 or 5 times a year because of glucose problems. If you do that, then don't come and blame hypertension medications, and then people go on social media, they sit in the bar, they are drinking, and then they are talking. all kinds of, saying all kinds of things. All right. So I'll end here. I'd like to take your questions. Let's get interactive and let's talk. SynLab does all these great tests. You can contact them on these numbers. If you want to book for a consultation to see a doctor, you can do so. Also, there I pass through every now and then. So let's talk, and then let's see how we can reduce together. We can all work to reduce the prevalence of kidney disease in Ghana.